So we're doing the hand and wrist views for this week, making sure the patient is not pregnant, having them remove all of their jewelry, and making sure we have the proper shielding over the pelvic region. So first we'll be doing the P to A hand. We'll be using a 10 by 12 cassette. Central ray will be through the third metacarpal phalangeal joint. The source image distance will be 40, and we're collimating to the body part we're trying to get the x-ray for. So we'll have them P to A, spreading their fingers. Again, central ray right here. And the anatomy being demonstrated will be the carpals, metacarpals, phalanges, and the distal ends of the radius and ulna. Next, we'll be doing the medial oblique. Here. So putting the right marker there. Again, we'll be using a 10 by 12 cassette. Central ray still through the third metacarpal phalangeal joint. 40 SID, and collimating to the body part we're trying to take the x-ray for. So again, spreading the fingers, making sure the patient doesn't move, and taking the x-ray. And the anatomy again for that one will be carpals, metacarpals, phalanges, and the distal ends of the radius and ulna. For the lateral hand, having them make the OK sign, spreading their fingers out so there's no superimpositioning, a little space in between the thumb and the first or the second digit. We'll be doing a 10 by 12 cassette. Central ray will be through the metacarpal phalangeal joints, which will be right about here. The 40 SID, and again, anatomy would be the carpals, metacarpals, phalanges, and the distal radius and ulna, though the radius and ulna will be superimposed, and the thumb and fingers should not be. Again, marker there, having them not move, and taking the x-ray. All right, for the wrist, come back to this here. We'll be doing a P to A wrist first. So again, spreading their fingers nice and wide. The central ray will now be going through the mid-carpal area, so right about here. 10 by 12 cassette, 40 SID, collimating to the area we're trying to see. And the anatomy being shown will be the carpals and the distal ends of the ulna and radius, and the proximal ends of the metacarpals as well. Having them not move, and taking the x-ray there. For the medial, we would be having them put their fingers into flexion a little bit to get rid of the space under the wrist there. So it'd be more here, having them not move, and taking the x-ray there. So for the lateral wrist, same thing, having them flex their fingers. To remove that space, we'll be using a 10 by 12 cassette. Central ray will be perpendicular. I don't actually matters. Perpendicular to the distal radius, so right about here. And the anatomy being shown would be the oblique view of the carpals. So again, having them not move, and taking the x-ray here. For the lateral wrist, we'll just have them here, still flexing their fingers. 10 by 12 cassette. Central ray will be perpendicular to the wrist, right about here. And the anatomy being shown would be the lateral view of the carpals, proximal metacarpal view, and then the distal ends of the radius and ulna, which would again be superimposed. For the ulnar flexion view of the wrist, here, having them ulnar deviate as far as possible. And central ray will be perpendicular to the scaphoid right here. Again, 10 by 12 cassette, 40 SID, collimating to the area we're trying to look at, and the anatomy would be the navicular and scaphoid without superimposition. And then for the carpal tunnel Guion view, we would have the patient pulling back their fingers here to get a good view. I guess we'd probably be using more of an angle here. So like this here, and the central ray would be 25 to 30 degrees cephalad view to the base of the 1 inch distal to the base of the fourth metacarpal, which would be like right here. Pulling that back, making sure that they are not moving, and taking the x-ray again, 10 by 12 cassette, central ray there at the 1 inch distal to the base of the fourth metacarpal, 40 SID, and the anatomy being demonstrated would be the carpal canal, the multangular tuberosity of the navicular, lesser and greater, and I think that's about it.